Glucosamine and chondroitin, are they effective for the treatment of osteoarthritis? At this point in time, osteoarthritis is one of the most common forms of arthritis in Western populations. It is a progressive disease of the synovial joints and is associated with the breakdown of cartilage in the joints, which most often occurs in the weight-bearing joints. Now, individuals with osteoarthritis have severe joint pain, tenderness, and limitations of movement that result in considerable morbidity and a quality of life that is severely degraded. In addition, there are tremendous economic burdens associated with having osteoarthritis, which is a direct result of the numerous healthcare visits and the associated medical cost. It is projected that osteoarthritis will become the fourth leading cause of disability by the year 2020, which is due in part to the increasing life expectancies. Unfortunately, there are no current effective remedies for osteoarthritis. Current clinical guidelines recommend a combination of pharmacologic and non-pharmacologic therapies to help patients relieve symptoms. But because of these non-pharmacologic recommendations, alternative treatment options such as glucosamine and chondroitin have received much attention recently by researchers and consumers. Now, glucosamine and chondroitin are two supplements that are commonly used by osteoarthritic patients. This is because the supplement companies that manufacture these supplements market heavy to osteoarthritic patients as a method to support joint structure and function. Now, the illustration on the left, this is a weight-bearing joint, the knee. You can see how the articular cartilage is intact. In contrast, on the right, you can see how the cartilage has been eroded in the osteoarthritic knee. Here's another weight-bearing joint, this time the hip. On the left, you can see with the healthy hip how the cartilage is intact. In contrast, you can see how the cartilage has been eroded for someone with osteoarthritis. Now, non-steroidal anti-inflammatory drugs, also known as NSAIDs, are commonly used by osteoarthritis patients. However, there are legitimate concerns regarding their long-term use. This is due to the fact that NSAIDs have poor safety profile on renal, gastrointestinal, and cardiovascular, along with other systems of the body. Thus, there's much concern regarding their safety for long-term use. Now, both glucosamine sulfate and chondroitin sulfate are considered symptomatic slow-acting drugs for osteoarthritis in Europe that can be utilized to slow the onset of action and possibly delay the progression of joint structure changes, along with the potential for symptom modification. But that depends on the health organization, and we're going to talk about that later in this presentation. However, it is important to note that the current body of research has not yet reached a consensus regarding the use of these supplements for osteoarthritis. This is because there are dramatically differing levels of evidence for these supplements, and the presentation will address why there are different levels of evidence later. In order to understand any potential structure-modifying effects of nutrients and their impact on cartilage regeneration, it is critical to understand the composition and metabolic mechanisms involved with normal cartilage turnover. Now, glucosamine and chondroitin are important components of the proteoglycans in cartilage, and some have claimed that these particular supplements can promote the repair and regeneration of cartilage. Now, cartilage is limited in its ability to repair itself. In contrast to other tissues, cartilage does not contain blood vessels or lymphatic structures, which directly limits the ability of these tissues to repair themselves. Now, although chondrocytes are responsible for maintaining the cartilage matrix, they only make up between 1 and 5% of the total cartilage volume. Now, proteoglycans are intertwined within the collagen network in the joints, and their negative charge results in a large amount of water to be enclosed within the cartilage. Now, this promotes resiliency by promoting elasticity and lubrication of the entire joint structures. Now, chondroitin is one of the body's natural glycoaminoglycans, and it is a critical component of the extracellular matrix. Now, chondroitin sulfate is composed of two alternating sugars, while glucosamine is an amino monosaccharide. Glucosamine is synthesized from glucose in nearly every tissue of the body, but is most abundant in the cartilage and connective tissues. Now, glucosamine is also an important component for the synthesis of the aforementioned proteoglycans, and it has been suggested by some that both glucosamine and chondroitin supplements may provide substrate for the biosynthesis of these proteoglycans, which could potentially repair damaged cartilage. However, the data has failed to provide definite proof of these supplements' effectiveness to promote this biosynthesis. Now, as I already mentioned, the articular cartilage is limited in its ability to regenerate, and glucosamine and chondroitin are major constituents of the joint cartilage. Thus, they are some of the most popular over-the-counter supplements sold. Now, glucosamine is extracted from chitin, which can be found in the exoskeletons of crustaceans, such as crabs and lobsters, as well as be extracted from mushroom cell membranes, while chondroitin is extracted from cartilaginous tissues. It's harvested from cows, birds, sharks, and pigs. Now, in vitro and animal studies have indicated that these two supplements can stimulate the synthesis of proteoglycans and reduce the premature breakdown of cartilage by inhibiting the synthesis of proteolytic enzymes. However, this phenomenon has not yet been confirmed in humans at this point in time. So despite this biological plausibility, there's no conclusive evidence that either glucosamine or chondroitin have a significant impact on osteoarthritis. Now, it is important to note that significant differences exist among the currently available studies that examine the efficacy of glucosamine and chondroitin for osteoarthritis. For example, several meta-analyses of pooled results from the currently available randomized clinical trials have demonstrated a significant overall heterogeneity of the results. Among these studies, there were significant differences in the design of the trials. Specifically, there was no standardization of the supplements used, the overall quality of the studies significantly differed, and the size of the studies also dramatically differed, which could have influenced the results. Now, what was most interesting to me were the differences between the large-scale studies and the small-scale studies. Now, the large-scale studies were considered to be high quality because they used masking and placebo. Also, the large-scale studies were independent. They didn't receive funding from the supplement companies. Now, the large-scale studies reported a much smaller effect, or no effect, compared to the small-scale studies. In contrast to the large-scale studies, the small-scale studies had a connection to the industry. They were directly funded or conducted by scientists that worked for the companies. Surprisingly, or not surprisingly, the small-scale studies reported a much larger effect compared to the large-scale studies that were conducted independently. Now, one possible reason for the lack of consensus regarding the effectiveness of glucosamine and chondroitin among researchers could be due to the fact that these supplements are sold over the counter in the United States, while these supplements are prescriptions in Europe. Now, it is important to note that significant differences in the formulations between the over-the-counter supplements and the prescription supplements do exist. Specifically, there are significant differences in the molecular formulas. Research has indicated that the prescription crystalline glucosamine sulfate has a much greater bioavailability. Also, research has shown that the glucosamine hydrochloride, which is the most common over-the-counter supplement, have a much lower bioavailability compared to the prescription version. As a result, the European Society for the Clinical and Economic Aspects of Osteoporosis and Osteoarthritis recommends that the prescription version be differentiated from all other formulations when examining the efficacy of these supplements. Now, as I already mentioned, chondroitin exists as sugar chains in the cartilage, and its ability to retain water promotes proper cartilage hydration. However, researchers are not certain what the potential therapeutic mechanisms of action are for chondroitin. In contrast, the mechanisms of glucosamine are much better understood. And research has indicated that the potential disease-modifying effects from the use of glucosamine may be the result of downregulation and the expression of various inflammatory and degenerative mediators. Now, this downregulation may result in the attenuation of cartilage degradation, which could potentially reduce the progression of the disease. Now, research has indicated that the glucosamine sulfate is a stronger inhibitor of gene expression compared to the glucosamine hydrochloride, which has been shown to have a minimal effect on gene expression. Thus, when examining the efficacy of these supplements, it's critical to distinguish between the different glucosamines. Also, it's very important to examine who conducted the research, and we're going to get into some specific examples of that later. Now, internationally, there is no consensus regarding the use of these supplements by the medical regulatory agencies. Although the European League Against Rheumatoidism recommends the use of glucosamine for the treatment of osteoarthritis, the 2012 American College of Rheumatology does not recommend the use of either glucosamine or chondroitin for osteoarthritis. Furthermore, the 2014 Osteoarthritis Research Society International guidelines gave the symptomatic slow-acting drugs in osteoarthritis for glucosamine and chondroitin the status of uncertain for their effectiveness for pain control for osteoarthritis. Now, researchers with a strong connection of the industry that produces these supplements suggest that the unfavorable recommendation for glucosamine and chondroitin may be the result of the lack of prescription availability in the United States, which, as I already mentioned, has a greater bioavailability, the fact that all formulas were pulled together in meta-analysis, and that the National Institute of Health gave negative trial reviews for the glucosamine chondroitin arthritis intervention trial, which is commonly referred to as the GATE study. However, there is one thing that they agree on. The consensus is that the glucosamine hydrochloride, which is commonly found in the over-the-counter supplement version, is ineffective as a treatment for osteoarthritis. So overall, the research examining the potential efficacy of glucosamine includes numerous studies that dramatically differ in quality. Now, a Cochrane review of 25 randomized control trials of all glucosamine formulations in nearly 5,000 osteoarthritic patients did not find any benefit in the use of glucosamine for pain. However, when the randomized control trials used the prescription version, it was found to be superior to placebo for both pain and function. In contrast, the randomized control trials did find that the non-prescription version failed to demonstrate a significant benefit for either pain or function. Now, there were 3 pivotal trials of the prescription crystalline glucosamine sulfate, which were judged to be of high quality. Now, although the effect size of the prescription crystalline glucosamine sulfate was moderate at 0.27, it was still greater compared to the effect size of paracetamol, which is a commonly used short-term analgesia for osteoarthritis. Also, the effect size of the prescription crystalline glucosamine on pain during treatment between 6 months to 3 years was equivalent to the effect size of NSAIDs for both pain and function. Now, the Pegasus study was a really interesting study, at least I thought so. It was funded by the pharmaceutical companies marketing symptomatic slow-acting drugs in osteoarthritis in order to assess the effects of these supplements in the use of NSAID patients with osteoarthritis. Now, The authors of the Pegasus study argued that previous research that examined the efficacy of these supplements had a flawed methodology, which they claim makes it difficult to assess the outcomes. According to the Pegasus authors, it's because NSAID use is subjective for osteoarthritis patients, and that there are limitations imposed in the studies by the standardization of rescue medications. But the Pegasus authors did not go into any detail what they meant by this. Now, for this particular study, the prescription version resulted in a 36% decrease in the use of NSAIDs. That was statistically significant. Now, similarly, an additional control cohort was created that resulted in a decrease in the risk of using NSAIDs by 26%, but it was at the very limit of being statistically significant. Now, secondary analysis had a decrease in the use of NSAIDs by 52% when the prescription version was used longer than 4 months. So the longer you use their supplement, the better you're going to feel, I guess. Also, the Pegasus authors reported that the glucosamine hydrochloride version is ineffective for the treatment of osteoarthritis. But there's one important note. The authors of this study were employees of a large pharmaceutical research facility at the time that produced the prescription crystalline glucosamine sulfate. But they stated that they left the company and decided to publish the data as independent scientists. So obviously there's a huge conflict of interest. Now, there is some evidence that long-term use of the prescription version may delay changes to joint structures, which suggests there may be potential benefit beyond symptom control. However, the currently available research has failed to reach a consensus regarding the effectiveness of these supplements' impact on joint structure modification. While one meta-analysis found no benefit, others reported efficacy in modifying the progression of the osteoarthritis disease. In addition, the later research suggests that longer use of these supplements may have a greater effect on osteoarthritis. Now, a really interesting study was just published this year in 2016 that examined the long-term effects of glucosamine and chondroitin and demonstrated a long-term protective structure modifying effect on knee osteoarthritis. Specifically, they reported that the prescription version was found to significantly reduce cartilage volume loss in the global knee associated with the lateral compartment. Furthermore, the same study reported that multivariate analysis demonstrated that the extent of the treatment's positive effect was related to exposure time, and that the protective effect at 6 years was significant in participants who took the prescription version for 2 or more years. What was surprising, though, is this protective effect of the prescription crystalline glucosamine sulfate on cartilage was not associated with symptom improvement, but the researchers believed that this lack of symptom improvement was due to a lack of control of analgesia intake. However, and this is a recurring theme, it's important to remember that the study was conducted by consultants for a laboratory that produced the prescription crystalline glucosamine sulfate. Now, likewise, the LEG study published in 2015, they reported that the glucosamine chondroitin resulted in a statistically significant reduction in joint space narrowing at 2 years. However, this reduction had no relevant effect on pain. Now, here are some potential biological benefits from the use of either glucosamine and chondroitin. And we're not going to be able to go through all of them in depth for the sake of time, but we're going to touch on the anti-cancer, atherosclerosis, dementia, and a couple other ones that I found very interesting. So, although the currently available research does not show that glucosamine or chondroitin are effective for osteoarthritis, Other research has indicated that there are other potential possible benefits of the use of these supplements. So most interesting to me were the results of 2 vital cohort studies of more than 75,000 persons, and they found an association between the use of glucosamine and chondroitin and a lower risk for colorectal and lung cancer. Now, glucosamine may also have a protective effect on heart health. One study cited in this paper indicated that the glucosamine can protect cardiomyocytes from an ischemia-reperfusion injury and also H2O2-induced cell death. Also, early research indicates that the glucosamine could potentially be used as a treatment for atherosclerosis by decreasing the number of atherosclerotic lesions by a decreasing LDL retention. And according to a few studies, glucosamine may be a promising agent to treat ischemic acute kidney failure, and it may have the potential to treat TGF-beta1 induced renal fibrosis. Another interesting potential benefit of glucosamine is its potential to possibly serve as a neuroprotective agent, which research with rat brains shows that it can reduce stroke volume in rats' brains hours after an ischemic reperfusion event. Similarly, glucosamine may have the potential to prevent or treat neurodegenerative diseases, such as Alzheimer's. And it also may potentially be used as a treatment for wound healing by increasing the number of fibroblast and collagen synthesis. However, it is important to note that the aforementioned possible medical uses are only potential benefits that have not yet been substantiated in humans. Thus, randomized clinical control trials on humans are needed to confirm the aforementioned potential benefits. So, in summation, research has failed to reach a consensus regarding the effectiveness of either glucosamine or chondroitin for osteoarthritis. Now, there are a few studies that the prescription crystalline glucosamine sulfate may alleviate osteoarthritic symptoms. It's the studies that were funded by the industries that produce these supplements that reported the benefit. In contrast, independent studies failed to find any benefit. However, one thing that they agree on is that the glucosamine hydrochloride version is ineffective. And as I already mentioned, there are other potential biological benefits from the use of glucosamine or chondroitin, but additional research is needed to confirm these benefits. And here are the references.